Did you know that infertility is exceedingly rare? That is false. I'm Shakika. I'm one of the nurse practitioners at Caperton Fertility at the El Paso office. Let's take a deep dive into some of the myths to kind of debunk some of these. So, infertility, according to the National Institute of Health, one third of infertility cases are caused by female reproductive conditions. Another third is caused by male reproductive conditions. Another third by both parties or even some unknown factors. Let's try another one. I must try to conceive for at least 1 year. That is false as well. 1 year is the timeline is a guideline. Individual history and experiences can adjust this time frame. The American Society of Reproductive Medicine defines infertility as trying to conceive after 1 year of unprotected intercourse without conception in the childbearing partner under the age of 35. If we're over the age of 35 and also the childbearing partner, we should be evaluated at 6 months. Infertility impacts 1 in 5 women. That's common, right? I have a child, so I don't have any problems with fertility. That's false as well. Secondary infertility can occur, and it can include things such as our age. It can be complication with a prior pregnancy, weight gain, male factor, brothers with the same partner from the prior pregnancy, or a new partner. There's a lot of components that can go into secondary infertility. So it's important to let's get evaluated. Using birth control can cause infertility. That is false. Birth control is a valuable component, and often it can be utilized in different treatment plans. It is important to get an individualized approach for your treatment plan. Normally, after discontinuation of birth control, the normal cycle returns within 1 to 2 months. If by 3 months and you haven't had your menstrual cycle, hasn't returned, schedule an appointment with your provider just to kind of take a deeper dive and see if there's anything else that's occurring. Now try our next one. Irregular cycles automatically mean that I am infertile, and that is false. Identifying the cause behind the irregular cycles is important. Things like stress, exercise, imbalanced hormone, you name it, it can throw off our cycles. Speaking with your provider can get that individualized approach so you can identify why these irregular cycles are occurring. Certain positions during intercourse can improve my odds for a boy or girl. Unfortunately, that is false. The definitive way to identify a boy or girl prior to implantation is through IVF with utilizing pre-implantation genetic testing. Another question you may be thinking is, oh man, maybe if I have intercourse in specific positions, that'll get me that boy or girl. And unfortunately, science just doesn't back that quite that from it. Science doesn't let us know if we have intercourse in a specific position, it's going to increase the rate of a boy or girl or even pregnancy. Let's try another one. I shouldn't seek infertility treatment because I can't afford IVF. That's false. There is a wide variety of treatment options available for infertility that are far less expensive than treatment plans such as IVF. There can be things such as ovulation induction medications, intrauterine inseminations. There's a wide range. It's important to get that individualized approach to determine what treatment option best works for you. The other thing is there is some insurance coverage that's going to be available for fertility. I encourage you to take a moment to look into your insurance plans to see if that's an option for you as well. Let's try one more. My health has no impact on my fertility. Absolutely false. Our health plays a huge role in our success of an infertility treatment. This can be our age, it can be smoking, it can be diabetes, it can be our thyroid, and so much more. It's so important to look at our entire health as we're considering infertility components, infertility treatment. It's all as important. There are so many more infertility myths that are out there. I encourage you to speak with your provider to gain an individualized approach. We at Caperton Fertility value our patients' perspective and partner you throughout your journey. Again, I am Shika Misher. I am one of the nurse practitioners here at Caperton Fertility in our El Paso office. Look forward to connecting with you and walking with you throughout your journey.